Morning everyone, Andrea here from AC Podiatry. How are you? Happy Tuesday, back to school today. That's right, kids are in the car, well most of them. Some are getting the start tomorrow. I've already navigated the traffic, it's crazy. I'm sure there's some of you mums who are crying sending your kids to school the first time. Others are cheering. Yes, you've got your life back after the school holidays. It is a special time. I've got two going back today. But what I wanted to really do today was give you guys a heads up and a bit of a what to look for, okay? See, the thing is, kids are going back to school and a lot of them have been on PlayStations or Switches playing Fortnite and socialising with their friends. Others have been streaming Netflix or binge watching movies. Generally speaking, gone are the days where kids climb trees. They're not doing as much as they used to in the school holidays, okay? And especially with the hot weather, that was probably more the case. And now we're back in school and we're doing PE and we're running around with our friends at school, kicking the ball, doing all these wonderful things. And with that comes a real possibility of overuse injury. So you get back to school, you increase your activity. Any of you have seen me talk before, we talk about that spike or sudden increase in activity. That's no different for children coming back to school. You can get that spike, you can get that increase, and as a direct result of that, that can lead to some overuse type injuries. Now we see a stack in the clinic and it generally presents mid-Feb, late Feb after the kids have been at school for a couple of weeks. So what I thought I'd do is I'd jump on now and give you parents and you kids that are old enough to have Facebook accounts something to think about, to keep an eye on, and if your children are presenting with these kind of symptoms, to come and maybe get the help that you need, or at least to ask us a couple of questions and try and find out how to fix it, okay? So there's three real overuse injuries we see a lot of in children, okay? There's the three that I'm going to talk to specifically, one within the foot, in the arch, one in the heel, and then one in the knee, okay? So I'll grab my foot model to see what we're talking about. So the first one is generally we see on the inside of the ankle and through the arch of the foot, okay? It's generally quite nebulous. The more activity they do, the more uncomfortable it becomes. We generally see that in kids that have got slightly flatter feet and perhaps a little bit heavier. But if you get a child who's getting complaining of pain through the ankle, or on the inside of the ankle along the inside of the arch, okay, that is a common area of overuse and something that we would really recommend you get some help with. That will affect all ages, so from your little 6, 7 all the way up to your older kids about 17, 18, 19, okay, so that's the full gambit. But if someone does come in complaining of that, chances are they've spiked the activity and just overloaded that complex, because you do have a muscle that comes in through here which helps control and stop the foot from rolling in or flattening out too quickly. Okay, I'm going to fly through these, you guys are busy, okay? The second one, and any of you who've been watching me for long enough knows that I'm really interested in the Achilles and areas around the heel. But in the children, we have something that's called a calcaneal apophysitis. So children generally have a growth plate through the back of the heel here, okay? This will generally see in girls from about 8 to 10 and boys from about 10 to 12. It is a self-limiting condition, that is, if you do nothing, it will resolve in time. But like anything, how long is a piece of string? Okay, that time could be 6 months, it could be 2 years. It can be incredibly painful and significantly impact on a child's quality of life. So if you are having a child that's experiencing some pain in the heel, around the back, they'll generally hobble off the court. It'll be very uncomfortable after activity, okay? That calcaneal apophysitis, that is something that, again, we see really common and something that you should come and see us about. The final one I'm going to talk to is in around the knee. I don't have a model of the knee, but that's the anterior or the front of the knee, okay? It'll generally aggravate when kids are climbing stairs. So we generally see it in an older cohort, your 14, 15, 16-year-old child who's at high school. There's a lot of stair climbing, okay, moving in between classrooms. They may be going through puberty, getting a little bit heavier, and that's driving it out. We generally call it a patellofemoral joint pain, so the aggravation of the kneecap and how it slides on the front of the knee and a bit of a malalignment of that. So if you've got a child who's getting knee pain squatting or climbing stairs, walking in between class, if they've been sitting for a long time and then get up and they're getting that aggravation through the front of the knee, that is also something that we see a lot of, okay? And they're the three most common presentations on overuse, okay? So just to recap, we've got the aggravation through the inside of the ankle and across the middle of the foot. that'll be in a heavier child with potentially flatter feet, and we'll generally see that from the ages of 6 or 7 right through to late teenage, adolescence into late teenage. You've got that calcaneal apophysitis, where the growth plate and the aggravation at the heel, hobbling off the court, hobbling after activity. The more activity they do, the more uncomfortable it becomes, okay? It's what we call a calcaneal apophysitis. Girls generally 8 to 10, 9 to 11, and boys generally 10 to 12, 10 to 13. That's what we're looking at, okay? And then, as I said, the knee pain, that anterior knee pain, patellofemoral joint pain, generally your older cohort, active child, where you're getting aggravation squatting, climbing stairs, sitting for long periods of time, and they get up and they can't actually tell you exactly where it's sore. It's kind of like, oh, it's just kind of sore all over around the front of the knee. Okay, guys, I hope you found that useful. Kids, have a great day back. I loved school, being with my friends, mucking around, learning lots. Okay, enjoy it, keep well, and I'll see you guys on the flip side. Have a great day. See you later.